People who struggle with obesity and cigarette addiction are all around us, of course, in neighborhoods like this one. I came here to visit a man who kicked one habit, then found himself developing the other.
I got addicted. I got hooked on them, and that was in 1968.
Ronald Ward, who's 68 years old, became a 2 to 3 pack a day smoker after starting in the Army. He smoked for 40 years, and he didn't get serious about quitting until his doctor found he had a respiratory problem called COPD.
And my doctor said, "Ward, you smoke?" "Yeah, I do. I enjoy it." "Well, you're going to have to unenjoy it. You need to quit, or else you will, eventually, it will harm you, and you could die." And he got my attention.
Ward managed to quit, but in the process, he also managed to add 30 pounds to his 5'6" frame.
I started eating more. So when you quit smoking, your taste buds, your senses, you gain all your senses, especially the taste buds. Man, everything tastes better.
It's a common story, and it's a symbol of the way America's smoking problem has been replaced by an obesity problem. In 1955, nearly 57% of men smoked, about twice as high as for women, according to the Centers for Disease Control. That figure has fallen to about 16% of men in 2015, when it was 13% for women. At 11%, California now has the second lowest adult smoking rate in the country. Only Utah is lower. Meanwhile, 36% of Americans are now obese, up from just 13% in 1962, and that doesn't include people who are merely overweight. Dr. Ken Fujioka is director of the Center for Weight Management for San Diego's Scripps Clinic, and he's seen a lot of patients gain weight after they stopped smoking.
And when you stop smoking cigarettes, two things happen. One is most people eat about 225 calories more per day. But the other thing they'll do is they actually burn less calories when they come off of cigarettes. So they burn about 15% less, which is very significant.
The tendency to lose weight has long been a part of cigarette marketing. Remember those Virginia Slims ads?
Virginia Slims, you've come a long way, baby.
Smoking, with its links to cancer, heart disease, and emphysema, is still seen as a bigger health problem than obesity. Fujioka says he agrees, though he includes a caveat.
If I had 20 people that smoke cigarettes and 20 people that are overweight, then I would say, no, we need to worry about the people who smoke. I would really concentrate on getting those 20 people. But the problem is that we have so many more people, as you said. It's hard to find people who smoke now in San Diego. But if you look at how many people are overweight in San Diego, we're just the same as the rest of the U.S. We have a lot.
So for the fight against obesity, what can we learn from the fight against smoking?
And it is probably the biggest success story of public health.
John Pierce, retired from UC San Diego, is an epidemiologist, and he's talking about the decades-long effort to reduce smoking rates. He says he's seen plenty of ways in which the obesity problem parallels the now declining smoking problem.
The decline has not been so much on smoking cessation. It's very difficult for people to quit. It's been a major decline in who starts taking it up. Now, what we're seeing in obesity is the same thing. It is kids getting to 18 already obese.
Like in the battle with big tobacco, Pierce says the next step in the fight against the obesity epidemic should be to take on the food industry.
There's a playbook on how to do it now. But we need political will. And we need to empower our public health groups to actually run a program to prevent, to focus on healthier behaviors across the board.
Ken Fujioka adds that when it comes to obesity, society has identified some culprits.
So we can go after those, and it's actually working. So as you know, several years ago, we got sodas out of schools. Guess what? Kids don't gain weight when they're in school. You know when they gain weight? In the summertime.
Former smoker Ronald Ward says although he's had to struggle with weight, he is very happy to no longer be what he calls
compulsive heavy smoker. But the reason I said it changed my life, I feel healthier, I can breathe, everything tastes better, even water. When I smoke, it's funny how you don't realize the simple things of life that you miss.
Tom Fudge, KPBS News.